Hey, everybody, welcome back to another episode of Casual Conversations. I am your host, John Malanca, with Dr. Jordan Tishler, Adam Abodeely, as well as Dr. Suraj Tandon. Always great to see you guys. Thanks for being on here, and thanks for being part of the Association of Cannabinoid Specialists. Here's a topic that cannabis and pregnancy, using cannabis while pregnant. I mean, a lot of the moms that I've spoken to use it more for morning sickness. And again, is it something that, I think when you have a child, it's pure, pure, pure. And why add anything that may or may not be toxic into the mother that's going to go into the child? Topic, so I caught myself stumbling on that because, again, we don't want to offend anybody, but I just look at it of life in general as we get older. So, what are your thoughts using cannabis while pregnant? Does it stunt the baby's growth? Does it help? Does it stunt any development? As well as bring on any short-term or long-term health issues. Who wants to take on that one after that intro?
Well, before we get into that question, let me just preface this by saying that, what we're going to talk about this evening is challenging because there is a lack of human data. And clearly, anytime pregnancy is involved, it's very hard to study, and there are a lot of opinions and a lot of players who have those opinions. However, things we do know from the preclinical research is that cannabinoids do readily pass through the placenta and into the fetus, as well as accumulating in breast milk in the postnatal period, and that the cannabinoid receptors are deeply involved in the appropriate development of the embryo and later the fetus. And so there is, in fact, every reason to be concerned that exogenous cannabinoids could have effects, deleterious or not, that's up in the air, but it's very reasonable to be concerned that there could be some kind of outcome associated with cannabinoids during pregnancy. So with that as background, let me then redirect to my colleagues to answer your question.
I'll jump in. I'll say I agree with Jordan. Is one, I think it's certainly better to be safe than sorry. I'll also preface by saying the absence of evidence does not mean evidence of absence. Just because we may not have data right now does not mean that there may be a potential risk, to developing children. I think there's certainly some data, maybe not of the highest quality, but certainly there is some data in mothers who had or were consuming cannabis prenatally. There was some long-term effects in those children later on, between 9 to 12, with respect to problem-solving skills and IQ performance. Now, again, very controversial. There's a lot of things that we can't control for with respect to child rearing, socioeconomic factors, other substance use as well. But I think in this case, what I do in my practice is really with respect to any type of cannabinoid until we know better, and certainly understand that some mothers may have an interest in using cannabinoids and find it to be quite effective as an antiemetic, as a medication to suppress nausea, which, again, one of the indications to use. But then again, like many other long-standing tested medications, many of these other antiemetics are sometimes contraindicated in pregnancy as well. So I think my point is that right now we don't have enough data. I think it's better to be safe. What I do in my practice is test any woman of childbearing age, even if they know that they are planning to become pregnant, or if they have no idea, or it's unbeknownst to them that they are potentially in the process of conceiving or pregnant, is to really just limit and reduce the risk of exposure until we know more.
Yeah, great point. And you brought up a point we didn't bring at the beginning. If you're in the process of trying to get pregnant, when would you recommend a mother to stop not only cannabis or even alcohol? Would you say 30 days, longer, shorter?
I say 3 months.
3 months. Okay.
And part of that is that, there's sort of that 30-day kind of rule out there. But that's an average, right? And I've had patients who are not heavy users, but they're consistent users, meaning they might only be taking 10 milligrams a day, but they're doing it every day. I've seen them remain urine tox positive for out to 3 months. So I think that if we're doing preconception planning, then we want to err on the side of the outside margin rather than the inside margin. So that's why I say 3 months. And acknowledging full well that if any of these women are seeing me because they have a therapeutic need, meaning there's some illness, whether it's anxiety or nausea or whatever, that taking them off their successful medication is challenging, right? And but at the same time, to Dr. Tandon's point, is that the risk here of having a child who is damaged in some fashion, and that is a lifelong problem that then flashes back on the parents, right? I mean, presumably in the best case scenario, there are 2 adults involved in this pregnancy, and perhaps grandparents and other relatives to be, and all of them may develop an opinion about this, rightly or wrongly, but the social result of that is potentially bad news, right? Again, to Dr. Tandon's point, erring on the side of caution prevents bad news from happening.
How about Dr. Abodeely?
Yeah, no, I agree with everything that both Jordan and Suraj have said. I have not personally been approached by somebody who was pregnant who was looking to utilize cannabis, but I've definitely worked with several women who have been of childbearing age, and this discussion is had. And if there's one take home, message for our audience tonight, one of the things that I always tell my patients who are childbearing age is I just tell them that as of right now, and everyone on this panel can correct if I'm wrong, there's not one professional medical organization right now that endorses the use of cannabis during pregnancy, including us. That's right. And so I tell them that, first and foremost, and a lot of that, and because I have had a couple who have at least rolled their eyes when I've made the comment about the potential risks if you should become pregnant. I don't personally pregnancy test before. However, I do have all the primaries are involved. I mean, aware of their cannabis use, and I have that's part of their kind of standard consent process that they go through. So although there is there's mixed, the literature's mixed out there, I take the same position that right now our first is avoiding risk, and it's extremely difficult, as Dr. Tishler, I know you had mentioned previously that it's extremely difficult for us to correlate and randomize any study to determine the outcomes of a child 10 plus years down the road, and going to be very difficult for us to ever conduct a study like that, to be quite honest with you. So at this point, there are alternatives to cannabis, and that have been studied for whatever condition we might be using it for. So I just try to hit that, send that message home with the patients. So, not to just protect themselves and the fetus and future adult, but also as our professional medical licenses, because if there was ever anything that was potentially linked to cannabis that was a harm to a fetus, I can assure there'd be people out there that would be more than happy to support that lawsuit against a physician who advocated for the use of cannabis during pregnancy.
Well, or worse yet, there are overzealous attorneys general out there who have prosecuted women for cocaine use. So, I mean, the idea that there couldn't be maybe criminal, but certainly acrimonious family interactions that could spill over into court. I mean,
yeah. Right.
When this topic was submitted, and thank you for our audience to submit. These are topics that most of the time are submitted by you, our listeners. When this topic was submitted, I automatically, and probably many automatically assume THC inhalation. What are your thoughts of other cannabinoids besides THC for an expecting mother?
At the Association of Cannabinoid Specialists, we are on a mission to train healthcare providers using research-backed science and to advocate for delivery systems that better serve patient care. Our children need us, and our parents do too. Help ACS bring care and relief to all who need it. Donate to ACS today.
Well, if we don't know much about THC in pregnancy, we know far less about any of the others. And, one of the things that really sort of winds me up in the current political climate is that people get, and by that I mean politicians mostly, get very focused on regulating THC and other cannabinoids that get you high. But really, all of the cannabinoids are biologically active. And so just the fact that it doesn't get you high doesn't mean it isn't doing something else that could be bad, right? Or good. But the point is, the question of whether it causes an intoxication is really not the yardstick to use here. The yardstick to use is, what does it do to your biology? And the intoxication is kind of obvious, but it's just, it's looking where the light is, not where the coin was lost, right? We have to view these things as really equally potentially beneficial or deleterious. And we have to do the research to figure out the when and where and how to use them, if at all, so that we use them positively and not negatively. But, the fact that one gets you stoned and the other doesn't really change the biology of it.
To piggyback on Dr. Tishler's comment, I agree. I think if we set aside just the topic of pregnancy, but we look at, let's say, other populations, adolescents, individuals under the age of 25, why do we not allow or encourage use of cannabinoids, whether it be THC or CBD or any other type of cannabinoid in, teenagers or young adolescent individuals? One is because we know that the brain's not fully developed until really around the age of 25. And we do know that, yes, there are certain types of cannabinoids that have or can cause psychomotor impairment, others that are non-psychomotor impairing. But we understand that it certainly can affect our pathophysiology in terms of the molecular structure within the body. And the effects of it are not entirely known. And we know that since the brain is not fully developed until that age, there's a greater risk of manifesting certain types of diseases. And I think that's why there's, sort of more of a stance that, listen, if we're not encouraging and prescribing it in minors under the age of 25, then it's sort of a moot point, especially if we're having this discussion with respect to pregnant women.
So let me throw one at you guys. Post-pregnancy. I've waited 9 months, maybe even 12 months with your 3 months, Jordan, prior to being being pregnant. Now I'm breastfeeding. And same type of thing. I know there have been studies, not to throw it back out there, but there are studies down in Jamaica with the mom's breastfeeding with the cannabinoids in the breast milk, and that could be another topic. But so the same thing as recommending physicians as you are, would you also share with your patient even post pregnancy to?
I think the word I focus on is weaning.
Weaning.
Right? So after the kid is no longer on the breast milk, then we can go back to therapy. But until then, we know that the cannabinoids are not just in the breast milk, but concentrated in the breast milk, meaning that the breast milk may actually have a higher concentration of cannabinoids than the woman's bloodstream, and therefore what it is that she's experiencing. So I just think of pregnancy and breastfeeding as sort of one block of time.
Yeah, that's right. Yeah, I always the talk is pregnant or breastfeeding.
I'll make one comment. I think for any of the listeners out there, whether you are a practitioner or a non-practitioner but have questions or with respect to cannabis use, safe cannabis consumption, one is I will certainly suggest is reaching out, becoming a member of the Association of Cannabinoid Specialists. Again, a lot of our conversations are with respect to best evidence practice and data. There is certainly newer updates that keep coming out, and I think it's sometimes very hard to stay on top of all the literature. But one of our focus is to really help make safe prescribing a lot easier for those practitioners, but also for the non-practitioners where they want to come to good quality evidence-based information, and that's through ACS.
Well said. Well said. Dr. Tandon, Dr. Abodeely, and Dr. Tishler, always a pleasure being on this casual conversation with you. I'm your host, John Malanca, with the Association of Cannabinoid Specialists, and we thank you for another episode of Casual Conversations. We'll see you soon. Bye-bye.